A healthy 10-month-old presents with a belly pain, vomiting, and bloody stools. A palpable tube-like mass in the abdomen is present on exam. What are you going to do for a diagnostic study? You're going to do an air contrast enema? How about a barium enema? How about an abdominal CT scan? How about surgical exploration? What do you think? You got 12 seconds. Kid comes in. All right. Now, hopefully with these questions, I've written board questions. Here we're giving the diagnostic. We tell you what it is. The big thing is what do you do about it, how you treat it. That's what's important. An air contrast enema, that is exactly correct. All right. So intussusception, again, happens about 2 months to 5 years of age. The peak is about 4 to 10 months of age. They present with pain, vomiting, bloody stools, and they'll have that current jelly stool. All right. What happens is when the bowel telescopes inside of itself, it affects the blood supply to the mucosa. So some of the mucosa sloughs off. And so that sloughed off mucosa gives you that current jelly stuff that comes out. The lead point can be a bunch of things. It can be a Peyer's patch. You had a recent infection and there's some active lymphoid tissue. That's why you tend to see it in the ileocecal area. Also polyps, they have a polyp. That can act as a lead point. When you examine them, you'll feel like this sausage-shaped mass in the belly. And you diagnose it and you treat it with that air contrast enema. Because if you cause a perforation or anything with air contrast enema, well, you're going to send them to surgery, but you're not going to have contrast in the belly. If you do one with contrast and they perforate, you're going to end up with contrast in the abdomen. Not a good thing. So you diagnose it, you treat it with an air contrast enema. If you don't reduce it, if you can't reduce it, then you have to send them to surgery. The recurrent rate is 10%. 10% of the time it'll happen again. Guess how you treat it? Air contrast enema. You do it again. Hopefully, whatever the etiology is will resolve over time, and they will quit having intussusceptions.